I wanted a program that would give me an opportunity to train in a really wide area of knowledge. So I feel like Joe's gives me operative deliveries, it gives me GYN surgeries, and I feel like I'm gonna be a really well-rounded generalist after this program, which would allow me to practice in a rural area and feel competent with that.
I think people that would thrive at this program would be people who like to work together as a team, people who like to do outdoor activities together, people who want high surgical volume or to work on their Spanish skills.
I think our program is great for people who are really looking for a little bit more of like an individualized residency, where they're not kind of caught up in what the program needs, but really what the resident needs. And so I think that makes it really special.
I think just the culture of the hospital and our residency program is so friendly, and that's something that I think set us apart from any other residency program. And I feel like that's one of the foundations for us to create a good environment for training in our specialty, who sometimes can be very challenging and stressful.
It's a great model to practice in, where the residents and attendings enjoy working with each other. It makes it a lot easier to do the everyday teaching that has to happen. It's a great way for residents to learn the way to model behavior.
We get to see them in many different clinical scenarios, whether it's in clinic or in surgery or on the labor deck. Being able to get their knowledge and their wisdom is really important. And I think that they also really value us as people and want to know us outside of work too. So we've had like many occasions throughout the year where we get to hang out with the attendings. And so I think that they really value us both in and outside of work.
It's not just the people, it's how people rise to support each other and elevate each other. And that's meaningful to me because I always feel supported in every capacity.
In OB-Gyn Residency, you get really close with your co-residents. And so we, both inside the hospital and in clinic and outside, are really close friends. We take care of each other, we pick up shifts for each other, and we really try to create that positive environment so that we can all get through these 4 years together.
In addition of their good clinical training, I think we have many opportunities for the residents to get involved into advocacy and women's health. They even go to Congress, to the Capitol, to advocate for women's rights here in Colorado. And I think one of the goals of a residency is just not only to train good OB-GYN doctors, but also future leaders in our field that can make a change and continue to improve women's rights and women's health.